MMR is a triple vaccine. It's a combination of measles vaccine, mumps vaccine and rubella vaccine, all in the one shot essentially. And it's a major step forward in terms of immunisation, because with the one vaccine we can protect children against 3 diseases.
We're going to also be giving him the measles, mumps and rubella injection, the same one as he had when he was 13 months old.
So what do you say to parents who are a little concerned about giving their child that triple vaccine?
Well, the 2 things I would say is that we've had an incredible amount of experience with MMR. There is one group of doctors who seem to think that there is a connection with autism and bowel disease, but subsequent studies have shown that this is not to be the case.
Give me a big hug, Mummy. That's it. Ready?
It doesn't cause autism, it doesn't cause inflammatory bowel disease. It's a very safe vaccine, and essentially most countries in the world have introduced the MMR, and it's been in use for something like 20 years in some countries without any major problem. It seems in this country this hysteria about the side effects or potential side effects has caused loss of confidence in the MMR.
I don't know what to believe. I haven't got 100% confidence in what they're saying. So unless I was 100% confident, I wasn't prepared to go ahead with it.
The more people you speak to who are saying no to the MMR, the more you are concerned yourself. So it's a general consensus around our sort of group that they won't have it.
Before we introduced MMR, there were around 10 to 11 deaths per year in this country from measles. And measles generally presents as a highly febrile illness with a rash and a runny nose, conjunctivitis and a cough. And the complications from measles are what we're concerned about. The major complication that we're concerned about is encephalitis, and that occurs about in 1 in 1,000 patients. Around 20 to 30% of those patients can die. So patients can die from measles, and the other 30 or 40% can have neurological disabilities, in other words, be permanently brain damaged. And that's just from the measles.
Between 1970 and 1988, we used measles vaccine alone. And we had only modest control of measles at that time. It was really only following the introduction of MMR in 1988 that we've had really effective control of mumps, measles and rubella infection.
When you hear people saying things like that, yes, it will, for an instant it probably would convince you, but then you hear the side or the mothers of the children that are autistic, and then that makes you think again. And the amount of people, as I say, even Mr. Blair didn't even admit to having MMR, his child, the vaccination.
I would just say take everything that's on offer, really, but do the research. I mean, if you're worried, there's plenty of resources, and health visitors are always there to give you information. If you're worried about any of the adverse publicity there's been about some immunisations.
Personally, every time I opened a newspaper, there was some other person who was worried that their child had autism because of the MMR. And I just couldn't take the risk myself. But obviously I know lots of people, lots of my friends have had the MMR, and I don't know anyone that's had any problems with it.
Important that parents talk to their doctors and their paediatricians and obtain their advice about the MMR.
So you still think it's better to give that one jab rather than 3 separate jabs?
That's my opinion, certainly.